Hello, everybody. I'm Dr. K. Agarwal, President, Heart Care Foundation of India and Group Editor in Chief of Ijcp Group. Welcome to our academic feast, a feast which will also give you a solution of a gaseous distension when you actually go for a feast. Yes, we are talking about dyspepsia, and our guest faculty will be Dr. B.D. Goswami. He is He did it MD medicine from Guwahati Medical College. He completed his PhD in gastroenterology from Tver State Medical Academy in Russia. He did fellowship in gastroenterology from University of Virginia in 1999. Worked as head of the department of gastro unit at Guwahati Medical College and HOD gastroenterology at Dispur Hospital, Guwahati. He is a fellow of the Society of GI Endoscopy of India, fellow of American College of Gastroenterology, fellow of Royal College of Physicians. He is a recipient of Economics Times Inspiring Gastroenterologists of India Award in 2018, more than 53 national and international publications, and has made several scientific presentations outside the country. Namaskar and welcome Dr. Bhabadev Goswami ji.
Namaskar.
Namaskar. So the topic we are discussing today is dyspepsia, gaseous distension of the body. Sometimes it causes embarrassment. Obviously, we are talking about dyspepsia once we have ruled out a cardiac dyspepsia. We know that the inferior wall of the heart is touching the diaphragm, and if there is an inferior wall ischemia, or there is an inferior wall myocardial infarction, sometimes you may have abdominal discomfort as the only symptom of an oncoming angina or heart attack. Therefore, we always say any burping, any acidity, any abdominal gas appearing for the first time in life after 40 or after the age of 30, if you have a family history of heart disease, first rule out cardiac angina. First rule out underlying heart blockages, which can actually present with acidity or a burping. What we are talking is we have ruled out a heart disease. A person says, my 6-minute walk test is normal. I can walk 500 meters in 6 minutes without getting any dyspepsia. And you are not suspecting any heart disease. In that situation, we are talking about what can be the abdominal causes of dyspepsia, how to handle them. Most of the people will go back and they start watching TV, and then they start getting TV ads that somebody has a bloating and he drinks that tablet or a liquid, he becomes all right. But today we are talking about science. We are not talking about those ads. So we'll talk about what to do if you have a dyspepsia or if you have an intestinal gas. So let's first listen to Dr. Goswami. Can you explain an update on abdominal gas, intestinal gas, stomach gas, burping, dyspepsia, getting all types of abdominal discomfort?
Yeah, thank you, sir, for your introduction as well as about the dyspepsia. You have already mentioned about to rule out the cardiac cause fast. That is the rule for everyone as a clinician to do it. The point is about the bloating or dyspepsia, or for that matter, cramping, distension. All these complaints are very frequently a complaint by the patient or any generation of the people, but it is a frustration for the clinician at the same time because the bloating or distension, in both ways, if we see that bloating is an observable at the finding perception from the patient. It is an objective one, whereas distension is particularly, if we can see that it is a subjective one. First of all, if you see For all of us, for any problem, we used to say that I have got gas. For the pressure, I have got gas. For my loose motion, I have got gas. For my headache, for my vomiting, everything is explained as a gas. But the point is, in medical science, from the gastroenterology point of view, we have got dyspepsia or gas for three matters, for three particular causes. The first of all, it may be a functional dyspepsia. Next is it is an organic cause. Dyspepsia due to organic causes. There may be something wrong with the intestine, for the stomach, or esophagus, and we may have got gas. And thirdly, it may be non-GI causes. There are so many other issues. The patient may feel that he has got gas for that matter. So whenever a patient say or complains that he has got gas or bloating, we have to check first whether he has got any organic causes or not. For example, he may have got the gastroesophageal reflux disease, he may have the gastric ulcer or duodenal ulcer, ulcer in the stomach or duodenum, or he may have the carcinoma of the stomach. So these are the organic common causes which they present to have the gas for the patients. So if it is not there after investigation, ruling out the causes that are organic to the patient, then we can put the word that it is a functional dyspepsia. Next, another particular point we should remember that the gas in the stomach or in the intestine, how it is formed. First, we have to remember that the gas is mainly to the stomach, it comes for aerophagia. While taking food, while drinking something, we also swallow a lot of gases. It may cause, or we call it aerophagia, gas in the stomach. On the other hand, we have got the gas in the intestine, and that gas is actually produced by the microbes that are inside our intestine and the colon. We have got the more than 10 billions of the different microbes inside the intestine. And these microbes in the intestine, it ferment the carbohydrates from the undigested food from the intestine, and it can cause the gases. So that's why whenever the patient has got aerophagia, whenever it has been formed in the colon, mainly the bacteria, they have got gas. And sometimes, as I have already mentioned, that it may be the gas or bloating sensation due to the structural diseases of the intestine or in the GI tract. So now the question is how we can get the relief of these symptoms. We have got so many medications and that we have to use, and but before that, probably if it is a structural disease, structural cause, organic cause, we have to address that issues, ulcers, gastroesophageal reflux disease, or the carcinoma of the stomach. We have to deal on with it, and after that, if it is find out that he has got the functional dyspepsia, we have to take care of that. But
So in
whatever, yeah, sir,
so in functional dyspepsia, let's now concentrate on functional dyspepsia. But
yeah,
before that, let me remind people, specifically the doctors who are watching this program, that all our life, whenever we ask for a X-ray abdomen, we always used to give them activated charcoal tablets the night before. What was the purpose and what is the role of activated charcoal in managing gas while doing a X-ray abdomen?
yeah. This is very interesting point, and everybody should actually think of it because the activated charcoal it absorbs the gas from the intestine, from the stomach, from the intestine. So that's why actually main purpose is to give the activated charcoal. And for that matter again, we have got the simethicone, another preparation which also absorb the gas from the intestine and from the stomach, and that's why it can give relief to the symptoms of gaseous distension, bloating, burping. All these problems can be relieved very, very seriously with the simethicone. So then we have got the combination of these two. Nowadays we have got the preparations like uh, simethicone plus activated charcoal, and these preparations immediately goes to the stomach, releases in the stomach within 5 minutes, mainly the simethicone, and rest part of the circle it goes to the colon intestine and it is released there. So within 2 hours ultimately all the combination of simethicone as well as the activated circle acts inside and give relief to the patients from bloating, burping, distension and all.
So at this moment, we talk about simethicone and activated charcoal combination.
Circle.
Let's have some evidences. Can you give us some evidences in terms of efficacy, safety, long-term use, and gender use? Can we use it in the children, elderly? Can you give us some evidences?
Yeah, there are some studies already published and some studies on the way also. So here we have seen that this is very safe combination. There is very less side effects. In fact, we can say that without any side effects, we can use it in any age group of patients, even a large age group of patients. Simethicone as well as the activated charcoal can give relief the symptomatic part of this dyspepsia. So safely we can use this medication combination because the simethicone 80 milligram combined with 250 milligram of the activated charcoal.
So if I have to use this simethicone and activated charcoal 80 to 50, can I
Yeah.
continue for how long? How long I can continue it?
Yeah, as a gastroenterologist, what I can say that usually we should give it for the symptomatic relief of the patient for 2 months safely we can use it. So after that, whenever it is necessary for the patient, they can use it and they can use it safely for long-term use also. There is no problem at all.
Now, if the patient has associated gastrointestinal if the patient simultaneously has gastroesophageal reflux disease, gastritis, acute, chronic, or he has a duodenal ulcer, can we still give it symptomatically?
Yeah, that is important also because already I have mentioned whenever there is a structural problem, for example, the patient has gastritis, the patient has got the ulcers, or suppose he has got the reflux esophagitis, we have to treat those conditions particularly on their line. For example, if there is an ulcer, either in the stomach or in the duodenum, we have our aim should be to heal the ulcers
आवाज कट रही
and
है,
relieve
आवाज
the,
कट रही है
and
सर.
for that matter we
दो
will
मिनट रुकना
use
होगा
the.
सर. इंटरनेट इज गेटिंग डिस्कनेक्टेड. आपको 2 मिनट दोबारा बोलना होगा.
Can
रितु
you
को
hear
देखो
me,
क्या
sir?
करना है. रितु एक सेकंड.
सर एक सेकेंड आप सर आपका इंटरनेट जा रहा है आप
मेरा किसका?
प्रीवियस नहीं इनका गोस्वामी सर का
Yeah,
अभी ठीक है सर आपको थोड़ा पहले से
Yeah.
बोलना होगा अगर
Is okay
डिस्कनेक्ट
now?
हो गया था
Hello.
ना अभी
या
ठीक
सर
है.
अभी
तो
ठीक है सर
मैं दोबारा पूछ रहा हूँ. So when it comes to gastroesophageal reflux disease, gastritis, duodenal ulcer, peptic ulcer, can we still use it as an adjuvant along with PPI or other treatment?
Yes, sir. These are very important questions. I have already mentioned that whenever there is a structural disease of the GI tract, for example, a gastric ulcer, duodenal ulcer, or suppose gastritis or gastroesophageal reflux disease, our basic aim has to be to heal the ulcer. And for that matter, we have to use the PPIs or H2 receptor antagonists and usually for 2 months maximum, we can heal the ulcer. Almost 95% of the cases with PPI, or 62% cases with the H2 receptor antagonist. So we have to use the PPI or H2 receptor antagonist for ulcers or for your gastroesophageal reflux disease. But at the same time, if the patient has got the symptoms of the bloating, symptoms of the dyspepsia, so for that matter, for symptomatic relief or immediate relief, we can use the simethicone and activated charcoal combination. And there is no harm at all. And I think my advice will be to aid this combination so that immediately the patient can get some relief before the patient has got the healed ulcer.
What about in patients with irritable bowel syndrome who have a non-specific GI symptoms? Disconnect.
Yeah, irritable bowel syndrome again is another problem for everyone. Because as a clinician, we have to see a lot of patients with irritable bowel syndrome. Though the exact pathophysiology it is not clear to us till today, the problem is most of the patients they used to complain the same issues of gas, distension, burping. All these problems are along with their problem of either constipation or the diarrhea, alternate constipation, or sometimes a mixed one. So again, in this group of patients, we can use or we can aid the simethicone as well as the combination of simethicone plus activated charcoal along with the other medication, whatever may be necessary depending upon what type of IBS we have got. It may be the mixed one, it may be IBS D, diarrhea, IBS C, the constipation. It is
So whether it is,
useful. Yes, sir.
go ahead.
Yeah, so it is used and it is seen almost 70% of the cases of IBS, they get relief of the main symptoms of the bloating and dyspepsia with the simethicone and charcoal combination.
Can I give it as a monotherapy?
Yeah, we can give in monotherapy also, but the studies are showing that it is better to give a combination one. That combination is a better, effective, and more tolerable for the patient. There is no problem with the patient when they take the combination one, and it is more efficacious.
Are there any contraindications?
Most of the time, there is no contraindication about these two combinations, as in monotherapy as well as combination also. There is no contraindication at all. Only point is we have to tell the patient that the color of the stool may be slightly dark yellow, dark greenish or dark black. That may be in some patient they used to, but we have to tell them before giving the medication so that they are not worried about the color of the stool.
Is there any change in dose if the patient has a kidney disease or a liver disease?
No. For the liver disease, there is nothing to worry. We can give the full dose. In kidney disease, maybe slightly reduced dose can be given.
Lots of patients are developing post-COVID dyspepsia. In fact, 20 to 30% of the patients are developing post-COVID dyspepsia. So do you think that this can also be given to these people for 3 months to take care of post-COVID dyspepsia?
Yeah, after this COVID, of course, we have got a lot of patients who have got the complaints of dyspepsia. And my opinion is, yes, safely we can use this combination for those patients who have got post-COVID dyspepsia.
So what we have learned today is, number one, dyspepsia means formation of gas in the stomach or in the intestine. Number 2, gas means fermentation of carbohydrate. Number 3, fermentation means that partially digested carbohydrate produces gas in the body. Number 4, you need a symptomatic relief. Patient is really uncomfortable with bloating, abdominal pain, discomfort. Number 5, once we have ruled out a heart disease, we need symptomatic treatment. We have a safe long-term medicine available, a combination of simethicone and charcoal. It can be given at all ages. No contraindication in liver kidney disorders, no contraindication in pregnancy, in breastfeeding, no contraindication in the elderly. Therefore, it can be given as an adjunct. It can be given as a monotherapy, means simethicone and activated charcoal combination, or can be given with combination of a PPI if there is associated gastroesophageal reflux disease. So remember one thing, make sure that your patients are not uncomfortable. Give them a proper guidance. There are randomized controlled trials available. Enough evidence is available that it is safe, and long-term use can really help your patients in getting rid of dyspepsia. Obviously, you need to rule out organic causes. And if they are organic causes, you need to treat them, whether it is IBS, whether it is ulcerative colitis, whether it is Crohn's disease, whether it is a small bowel loop syndrome, whatever is the reason. Yes, you need to take care of them. So gas has a medical established treatment. If nothing works, so gas has a evidence-based medicine that simethicone and activated charcoal works. That's all for today. Let me thank Dr. Bhabadev Goswami to be here with us. And if you like this video, kindly share it with your colleagues. Thank you.
Thank you.